Welcome. Welcome to Symptom Series, and today's topic is on nausea and vomiting. It is the most common symptom I've encountered, and this symptom I used to write in the exam whenever there was a case, and the first common symptom I used to remember was nausea and vomiting. So, whenever in your life when you have encountered nausea and vomiting, let us see its causes. What is nausea? Nausea is the sensation of wanting you to vomit. You can see this man, he's he's feeling like he's trying to vomit or he's wanting to vomit, but it is not actually vomiting. As in case of the next, the smiley, you can see him vomiting. Vomiting can actually lead you to dehydration. He just vomit out. I don't think so there is any definition for this. Next, what could be the possible causes of this nausea and vomiting? First of all, it could be due to dehydration, confusion, restlessness, or most commonly it could be gut related, that is your intestinal or stomach part. It is infected, or there could be some infections in your body which has caused you to vomit out, or there could be some infection which has led you to some cause that you couldn't pass out your urine, or you were not able to keep any fluids and just vomit it out because of that infection. But if it is this case that you're not able to keep any fluids, that is whatever is your intake, you're not able to take it inside your own gastrointestinal system through oral route or through your mouth, then that is you're unable to keep any fluids, then you should seek medical advice. That is really urgent case in that. Let us see each causes related to nausea and vomiting. When it comes to abdominal pain, as you know, in the abdomen you have the stomach, liver. The first case is gallstones. There could be right-sided upper abdominal pain that has accompanied along with nausea and vomiting. You may have fever or jaundice, yellowing of skin. You can see in this, there is gallstone in the gallbladder. The greenish part is the gallbladder, followed by cystic duct. I hope you can see the arrow of cystic duct. If not, this is cystic duct where my pointer is. Then the brownish thing is the liver. The pinkish stuff you can see is the stomach. Then the yellow colored gallstone is stuck between the cystic duct and the common bile duct. This is the common bile duct. Common bile duct or the common cystic duct. As due to the gallstones, there could be nausea and vomiting and jaundice-like symptoms in the patient. So this is accompanied with abdominal pain. The next case where there is abdominal pain along with nausea and vomiting is in acute pancreatitis. When these gallstones, when they try to enter the duodenum, as they are trying to pass through the duodenum, they are blocked by the pancreatic duct. The pancreatic duct gets blocked, means the gallstones block the pancreatic duct, not the gallstones block the pancreatic duct. In this case, the pancreas gets inflamed or it's swelled at that point, and this condition is called acute pancreatitis. You can find this condition, if there is this condition, you can find this clinical signs, Cullen sign and Gray Turner sign. In Cullen sign, there is ecchymosis around the umbilicus, whereas in Gray Turner signs, there is ecchymosis around the flanks. So the gallstones has led to this condition called acute pancreatitis. Means pancreatitis, swelling of the pancreas because the gallstones have blocked the path of the pancreatic duct. Next is cholecystitis. In cholecystitis there is right-sided upper abdominal pain that comes and goes with fever, shivering and jaundice. You can see in this case the gallbladder has shrunken in shape. In this condition, it is accompanied with abdominal pain and gallbladder is shrunken. Next, in case of alcohol misuse, there is also abdominal pain. That is, if you take more of an alcohol intake, there could be possibility of nausea and vomiting. If you have seen alcoholics, after they recover, they have this tendency, or if they have more amount of liquor, they vomit out. This is due to alcoholic misuse they have used. So alcohol irritates the gut, causing upper abdominal pain, nausea, vomiting, and you can also vomit out blood. Next case where there is abdominal pain along with nausea and vomiting is in case of kidney stones. The pain that comes and goes begins in lower back and moves to abdomen, often with blood in urine, and can lead to the need to pass out the urine. It is more common in hot countries. If symptoms are severe and persistent, then you should seek for medical advice. Next, as in case of peptic ulcer, there is upper abdominal pain, that is central upper abdominal pain. So you can see the healthy stomach here and another lining in case where you can find duodenal ulcer and some stomach ulcer. So these duodenal ulcer and stomach ulcer are referred to as peptic ulcers. These ulcers can actually just not be present with abdominal pain, but can also cause you to wake up at night and become more worse when you're hungry. So it will vomit out blood and you could have poor appetite. If you're vomiting blood, actually this is a very serious condition. You should look out for your doctor or the medical professional. Next is intestinal obstruction. In this case also, there is vomiting along with severe abdominal pain. When a person has failed actually to move bowels, he's constipated and is unable to do his bowel movement. So that's what is intestinal obstruction means here. So it can lead to vomiting and abdominal pain. Next is migraine. With headache, you face vomiting, as in case of vomiting or even nausea. Especially in migraine, you will feel nauseating. Often there is one-sided headache in migraine. There could be blurred vision and flashing lights, as in case of migraine headache, which is another cause of nausea and vomiting. Now comes is meningitis, the inflammation of the meninges. It is accompanied with headache, where there is inflammation of the thin membrane of the meninges. You can see the meninges here, and there is also a cut section of the brain where there is inflammation. I don't know if you can appreciate the inflammation, but there is vein inflammation and abdominal accumulation of cerebrospinal fluid. So as in case of meningitis, and It has affected the brain, not just the brain but the spinal cord and spine. So it causes rash, fever, headache, stiff neck, and general unwellness. It can be a medical emergency. Then comes is gastroenteritis. You're facing nausea and vomiting with diarrhea. There is a magnified glass here along the intestine. It is just magnifying, it has magnified the small intestine, and it is showing the various viruses and bacteria which are invaded during gastroenteritis, like the adenovirus, Escherichia coli, E. coli, Norovirus, or rotavirus. It is often associated with abdominal pain and change in bowel habits. Usually there is diarrhea in this case. So there is diarrhea plus nausea and vomiting because the gastrointestinal tract is infected with these viruses. So it is gastroenteritis. Let's see next. Food poisoning. In case you have ingested food which is contaminated in nature, which is stale food, which is leftover food, the first thing which can happen is food poisoning. Often it is accompanied by abdominal pain, diarrhea, nausea and vomiting. So you shouldn't have leftovers or stale food because it can lead to a condition called food poisoning. Next is norovirus. There is often diarrhea in norovirus infection. The diarrhea as well as nausea and vomiting, and it is most common in children. Actually, norovirus can also lead to death. Roundworm infection. Previously seen, norovirus can infect gut only. Even in case of roundworm, infection is there in gut only. In roundworm infection, there is chronic infestation causing general ill health in children, failure to grow or put on weight, even abdominal pain and diarrhea with rash, tiredness. So roundworm infection in children actually will lead the child to stunted growth. So we give deworming tablets in case of worms like roundworm infection. Mostly it affects the children. Next, kidney infection, that is pyelonephritis, where there is blood in urine. You can see two kidneys. One is a normal kidney and this one is an abnormal kidney. And in this kidney you can appreciate renal pelvis is here where my pointer is, and that's the ureter going, the whitish part. Along with it there are major cholecystitis, the cortex part. Cortex is this, I'm just encircled it, half semicircle, and these are pyramids, slightly browner than the outermost part, that is the cortex. These are the pyramid. In case this is the normal kidney, and in case of pyelonephritic kidney there is pus because there is an infection, so there would be pus formation, there is inflammation and even scarring of the pyramids, and atrophy of cortex. Atrophy, that is degeneration of this cortical layer. You can see that it is distorted. So in pyelonephritis there is vomiting with flu-like symptoms, blood in urine, back pain, and it is more common in women. So if this condition happens, you should seek medical attention. Next is chronic kidney disease. In case of chronic kidney disease, you can see a normal kidney and a CKD kidney, where there is, in normal kidney there is healthy function, proper size and low urine protein, means it can filter the urine properly, whereas in CKD or the chronic kidney disease there is granular appearance of the kidney and there is decreased function, means the urine does not filter out properly, and you can see the size of the kidney, it is smaller in size and there is high urine protein. The urine passed out has more of a protein content. In case of chronic kidney disease, there is loss of appetite, nausea, vomiting, fatigue, you'll feel tired, there is weakness, even itching, lethargy, swelling, shortness of breath, muscle cramps and headache. It is all due to the small structure called as kidney, where there you face fatigue, nausea, vomiting, even itching, muscle cramps, headache. There are so many symptoms which are occurring due to this. Next, with dizziness. With dizziness, what is the symptom? Nausea and vomiting is happening. You can see a normal ear structure here as it is a cut section. From the lateral side, you can see the eardrum. I don't know if you can see it properly. The eardrum and the eustachian tube. Eustachian tube is here. It goes like this. Then the middle ear and this part. You can see these three semicircular canals. The cochlear part. This is the inner ear, the middle ear, and outer ear. So in inner ear infection, so this image is actually of the eardrum. You can see the eardrum. In normal ear there is no fluid, but in case there is some air fluid, you can see some air bubbles here, and effusion full of fluid. Effusion is full of fluid. You can see this is normal and these two are abnormal structures of the eardrum. These three of the structures of eardrum in one microscope. So you can see it's not microscopic, but through the tonometer device you can see them. In case of these, if these two are infected, means they could be nausea, vomiting, earache, dizziness and reduced hearing. Next, this is in case of inner ear infections. Next is labyrinthitis. There is inflammation of the inner ear. You can see the cochlea, which is inflamed, as in case of labyrinthitis. Labyrinthitis is the inflammation, and it is inner ear inflammation. You can see the eardrum here again and the eustachian tube. This was eustachian tube and the cochlea being inflamed. As in case of labyrinthitis, there is nausea along with dizziness and vertigo, ringing in ears and pain around the ears or in the ear. That is case of labyrinthitis. Next comes is Meniere's disease. In Meniere's disease, there is dizziness, tinnitus, ringing sounds in both the ears, as well as hearing loss. You can see the healthy inner ear structure here, and in Meniere's disease, the structures are distorted. There is feeling of nausea in this also, and there are recurrent episodes of it. So let us see the inner ear here. You can see the balance canal, which are the semicircular canal, which helps in balance these three. Along with this, the hearing canal, the cochlea, and hearing and balance nerve. And here is endolymphatic sac. So as in case of Meniere's, Meniere's is also called endolymphatic hydrops. There is fluid which is more instilled in the endolymphatic sac, the Bacter fluid, which leads to swelling and pressure. And due to that fluid accumulation, there is swelling which distorts the balance information, that is the balance canal, and even the sound information which is filtered, which is done by the hearing canal. It will distort that also. So swelling distorts the sound information, and there is distorted information which travels to brain. So because of this distorted information which is traveling to brain, there is ringing in the ears or tinnitus in both the ears. There could be hearing loss in some cases with feeling of nausea. That's all. You can find the common symptom which we were reading was of nausea and vomiting. If you want, you can take a screenshot of it and in which conditions you find this symptom. So if it is with abdominal pain, then it was gallstone, acute pancreatitis, cholecystitis, alcohol misuse, kidney stone, peptic ulcer, intestinal obstruction. As in case with diarrhea, there was gastroenteritis, food poisoning, norovirus infection, roundworm infection, and with blood in urine, it was kidney infection, pyelonephritis, kidney stone, chronic kidney disease, and with headache, migraine and meningitis, with dizziness, inner ear infection, labyrinthitis, Meniere's disease. So that's all for the day. Thank you. See you next time with another symptom series. Thank you for watching. Do subscribe and like.